Hey folks, it's 6:03. This is precious time. I want to make sure I'm honoring everyone's time. So I think we're going to go ahead and get started with today's programming. Awesome. So before we begin, I want to introduce Mrs. Claudia Phillips, who has graciously agreed to translate tonight's forum in Spanish. Thank you so much, Claudia.
Thank you, everybody. It's my pleasure.
We will also have a recorded version of tonight's program in both English and Spanish available after the Thanksgiving break. So good evening, everyone. My name is Nakia Hall, and I am the Director of Advocacy for Achievement Frist here in Connecticut. It is an honor to be with you all this evening as we continue to seek sound scientific guidance and support regarding the vaccination decisions you'll be making for your family. We know that this is especially important now that the vaccine for ages 5 through 11 is approved and recommended by the CDC. K-12 schools are not currently requiring COVID-19 vaccination for students. We encourage families to prepare and plan ahead for the possibility of a vaccine mandate. If the state requires vaccination for children, that will apply to our schools, and we will communicate any changes and any updates as they occur. We are going to spend the first half of this evening hearing from medical experts about the science and data pertaining to vaccinations for 5 to 11-year-olds and the challenges our communities continue to face due to this pandemic. We are reserving the second half of the evening for Q&A with our panel. I'm sure many of you have come with questions and more will pop up during the course of this evening. Kindly type your questions in the chat box as they come to you. I believe you'll see Laura Calican's name, and that's who you will be chatting your questions to. We will get through as many as time permits, but promise to have all of them answered and posted to both your school's website and the Connecticut Charter School Association's website, which will be available again after the Thanksgiving break. Claudia.
Thank you. Buenas tardes, amigos. Mi nombre es Nakia Hall. Soy la directora de respaldo de Achievement Frist en Connecticut. Es un honor para mí estar con ustedes esta tarde a medida que seguimos navegando en la búsqueda de guía científica y respaldo con respecto a las decisiones que tomaremos para nuestras familias en torno a la vacunación. Sabemos que es especialmente importante ahora que la vacuna para edades de 5 a 11 años fue aprobada y recomendada por el Centro para el Control de Prevención de Enfermedades. Las escuelas de kinder a 12 grado no requieren por mandato que los estudiantes sean vacunados. Nuestra recomendación a las familias es que preparen un plan de anticipación en caso de la posibilidad de que se requiera mandatoriamente la vacuna para estos estudiantes. Si el Estado requiere la vacuna para los estudiantes, esto aplicará a nuestras escuelas. Les comunicaremos cualquier cambio y actualizaciones. Vamos a tomar la primera parte de esta sesión escuchando a médicos expertos.
Claudia, I think you're muted.
Yeah, Claudia, can you hear us?
Sorry, yeah, something came up that the host muted me. Okay. So, vamos a reservar la segunda mitad de la sesión para preguntas y respuestas con nuestro panel. Estamos seguros que muchos de ustedes han venido con preguntas y más surgirán al curso de la sesión. Por favor, escriban sus preguntas en el chat. Contestaremos tantas nos dé tiempo y les prometemos contestarlas todas poniéndolas en el sitio web escolar y en el sitio web del Connecticut Charter School Association, el cual estará disponible después del receso de Acción de Gracias. Nakia?
Thank you, Claudia. We are joined today by distinguished guests, Representative Antonio Felipe of Bridgeport and Senator Gary Winfield of New Haven. We want to thank these amazing leaders for their unwavering dedication to the communities they serve and for continuing to put students and families first. Representative Felipe and Senator Winfield, welcome. Claudia.
Hoy nos acompañan dos distinguidos invitados, el representante Antonio Felipe de Bridgeport y el senador Gary Winfield de New Haven. Queremos darle las gracias a estos dos increíbles líderes por su dedicación continua a las comunidades que sirven y por siempre poner a los estudiantes y a las familias primero. Representante Felipe y senador Winfield, bienvenidos. Queremos abrir la presentación donde ustedes le hablen a las familias. Muchas de ellos que nos acompañan son sus constituyentes. Nakia?
Thank you, Claudia. We want to open the floor to you both to briefly address our families, many of whom are your constituents on this call this evening. And a reminder again that Ms. Phillips will be translating, so please pause briefly for her to catch up. Representative Felipe, would you like to go first?
Sure, and I will apologize to everybody who wasn't on earlier. I am currently doing turkey deliveries, so I won't be on camera, but I'm happy to be here. I'm glad to disseminate this information and make sure that people who want to make that choice to get their children vaccinated, to help us really get towards the back end of what we're going through here, can do that safely with the best of information. And we can do it as quickly as possible so we can get right back to work doing what we do best.
Thank you so much for those kind words, Representative Felipe. Claudia?
Gracias, de antemano, discúlpeme, no puedo estar en cámara. En este momento estamos distribuyendo turkeys por acción de gracias, pero queremos asegurarnos, por mi parte y por parte de los representantes, que todo mundo que necesite esta vacuna tenga acceso a la información y a la vacuna de una manera segura. Muchas gracias por tenerme esta tarde con ustedes. Nakia?
Thank you, Claudia. Reverend Senator Winfield, the floor is all yours.
Thank you. Thank you for having me. So I'm glad to be here. I'm glad to be anywhere where we're talking about this, encouraging people to go out and get vaccinated, get their children, bless you, children and families vaccinated. I think it's extremely important. And I'm gonna pause periodically so that Claudia can catch up. Claudia.
Thank you.
El senador Winfield, primero que nada, quiere agradecer la oportunidad de estar aquí. Para él es muy importante estar en cualquier evento donde se vaya a hablar sobre las vacunas y el acceso a las vacunas. Senator Winfield.
And you know, I have a son who's at one of these schools, and I can tell you, we actually live across the street from the school, and so we're very short distance away, maybe a quarter of a mile. But during the height of the pandemic, it might as well have been 100 miles away. And during the height of the pandemic, the thing that I kept thinking about is I cannot wait for the day when he's able to go back to that school, not because I needed him to go back to the school, but because he needed to go back to the school.
También quería comentarles que tengo un hijo que está en una de estas escuelas y a pesar de que estamos a solo una cuarta de milla de distancia de la escuela, se sentía que la escuela estaba a una distancia enorme y una de las cosas que yo seguía pensando era que se sentía lejos y no podía esperar el día en que mi hijo pudiera regresar a la escuela en persona. Senator Winfield.
And when adults were able to get vaccinated and we were able to do school safer, he was able to go back to school, and it relieved a lot of the pressure on him. But when he went back to school, I was concerned about him being in the school, right? So when young people were able to get vaccinated, it took a lot of the stress off of me as a parent. And I know the same thing is happening for a lot of our parents throughout the system. I have two young people, one of whom was here right before we started. And my only concern now is when they can get vaccinated, because they're 3, they're not quite 5 yet. And so for me, this has been a thing that we've all gone through together. We've all experienced the stress, and having the vaccine has made it so much easier on us because we have to worry less about getting the COVID virus. And if we get it, we have to worry less about what it actually means. It's important for our families. And I am so glad for everything that you all have done and the cities and the municipalities throughout the state have done. And I encourage every parent who has a child in one of our schools, if you haven't done it, to really think deeply about it, listen to the medical experts, and consider getting your children. And if you're not vaccinated, yourself vaccinated.
Claudia, you can summarize. Go ahead.
Yeah, wonderful. So, una de las preocupaciones para el senador fue cuando los estudiantes regresaron a clases, la preocupación era los que no estaban vacunados. Él en este momento tiene también a sus gemelos, una de ellas estuvo con él, tiene 3 años, ella aún no puede ser vacunada, entonces para él lo más importante es que todos sepamos la importancia de vacunarnos para mantener no solamente a nosotros seguros y salvos, sino a otras personas también. Entonces, le doy muchísimas gracias a todos los que están haciendo este trabajo para impartir la información a las municipalidades y por favor, escuchen a los expertos. Thank you, Senator.
Thank you.
Thank you, Senator Wenfield. Today's conversation is brought to you in partnership with the Connecticut Charter School Association. I'd like to introduce Reuben Felipe, Executive Director of Pcpsa. Reuben is a steadfast leader committed to this work, and I am proud that we have partnered to present this important forum. Claudia.
Nuestra sesión informática ha sido posible en asociación con el equipo de la Asociación de Escuelas Charter de Connecticut. Me gustaría introducir a Reuben Felipe, director ejecutivo de CTCSA. Reuben es un líder incansable de alto compromiso en este trabajo y estoy orgullosa del trabajo en equipo para lograr ofrecer este foro de información. Reuben.
Thank you, Nakia, and thank you, Claudia. I'm going to be brief. I want to thank Nakia for bringing this about, and I want to thank my staff for working in partnership with her to make this happen, and of course our distinguished elected officials, and most importantly our panel and our parents who are here. I will say briefly that when I became eligible for the vaccine, we didn't hesitate. We went and got it. And when my daughter became eligible, who's 9, we paused for a second and we did some more research and we got information. And then she went this weekend and got vaccinated. So I understand that when it comes to your children, you're a little bit more cautious than you are for yourself. But I encourage folks, I'm glad that you're here, and I encourage you to ask all of your questions, and hopefully you feel comfortable in getting your children vaccinated.
Claudia, you want to share a little bit of that with our friends?
Sí, el director Reuben Felipe, básicamente dándole gracias al equipo y a todos, a los líderes directos y también a las personas que nos acompañan, a los médicos expertos y al resto del panel que está con nosotros. Solamente quería compartir que cuando la vacuna fue disponible, él inmediatamente tomó la vacuna, pero cuando su niña de 9 años, cuando la vacuna fue disponible para ella, tomó pausa, tuvo que pensarlo, tuvo que investigar un poco antes de hacerlo. Entonces, entiende que como padres vamos a tener reservaciones cuando se trata de nuestros hijos, pero está muy contento que estemos aquí para escuchar la información de los expertos que nos van a compartir. Thank you.
Really quickly, before I introduce the panel, I just want to say, Claudia, you're doing an amazing job. It's not the easiest thing. Plus, I want to hear you have to say that you're doing an amazing job.
Yeah.
A mi director dándome gracias por la traducción. Thank you, Reuben.
All right, well, these are the most important folks on the call, and I want to thank them in advance for spending this time with us to get this important information to all of us. And so I'm going to introduce our panel that's going to be here today. First and foremost, we have Dr. Elizabeth Rodriguez from Optimus Healthcare. We also have Lane Taylor, who's the medical director of the Village for Families and Children. And we have multiple members of the Bridgeport Health Department. We have Ebony Jackson Shaid, the Deputy Director of Health Clinics. And Ebony, if I mispronounce, please correct me. We also have Tammy Papa and Deidre Gruber. And Deidre is an APRN for communicable diseases. In addition, we're lucky enough to have our Bridgeport City Council President, Heidi Nieves, who's also the Regional Outreach Coordinator with the Department of Health, and Olivia Hines, who's the School Vaccine Program Coordinator. Claudia?
Hoy nos acompaña la doctora Elizabeth Rodríguez de Optimus Health, Lynn Taylor, directora médica de la Villa de Familias y Niños, y 3 miembros del Departamento de Salud de Bridgeport, la directora médica Ebony Jackson Shaid, directora adjunta de Clínicas de Salud, Tammy Papa, y Deidre Gruber, quien es una enfermera de práctica avanzada para enfermedades contagiosas. También nos acompaña la presidenta del Ayuntamiento Municipal de Bridgeport en su papel de coordinadora regional de difusión, y Olivia Hine, coordinadora del programa de vacunación con escuelas. Nakia?
Thank you, Claudia. Welcome all. I'm going to jump right in because we're going to cover a topic with important information. And this outstanding panel of experts from across the state is here to share their knowledge and expertise. Claudia.
Bienvenidos todos. Vamos a empezar rápidamente porque estamos hablando de un tema bastante importante. Este panel de expertos que nos acompaña a través del estado está con nosotros para compartir su conocimiento y su experiencia. Nakia?
Thank you, Claudia. Dr. Rodriguez, good to see you. I'd like to start with you. Now, there is so much misinformation out there, Dr. Rodriguez, that we hope you can shed some light on. So the first question of the evening for you is, how does the vaccine for 5 to 11-year-olds differ from the first vaccine?
Well, there's a little bit of a difference in terms of the dosage. The medication is still the same that the CDC developed for the adult. It's just for the child to get 1/3 of the dose. Okay, Claudia.
Oh, I'm sorry. Would you like me to translate it, or do you
Want me to try? I can do that. That's fine.
Yeah.
So la diferencia de la vacuna es que la dosis de los adultos es el tamaño completamente. Para los niños es 1/3. Quiere decir que son 30 microgramas para el adulto y el niño son 10. And so what the difference is, the technology is still the same. It's been in existence for 15 years. La tecnología ha sido 15 años. Lo diferente es que nosotros pudimos encontrar cuál fue el clase de virus. We were able to identify what class of the virus, and so we were able to produce the vaccine. The great thing is that with this now, we're able to vaccinate the 28 million children in the United States if the parents are agreeing to do it. Lo bueno con esto es que aunque es la tercera parte de la vacuna, todavía es una cosa buena porque podemos vacunar más de los 28 millones de niños que están en los Estados Unidos, porque la vacuna es igual, es una dosis más pequeña para el niño.
Thank you, Dr. Rodriguez. I have a 4, soon to be 5-year-old. So this next question I'm particularly interested in, what side effects can a parent expect after their child has gotten the vaccine? And what should they be keeping their eyes open for in terms of unusual side effects?
Sure. So the side effects are the same, kind of like any other vaccine. Los efectos secundarios son lo mismo de cualquier otra vacuna en cuestión de you will have pain at the injection site, un poquito de dolor donde le pusieron la vacuna en el brazo. You'll have some fatigue, el niño se va a sentir un poquito cansado. You'll have a headache and chills, puede coger calores frío y dolor de cabeza. Worst case, they'll have a fever, un poquito de fiebre, and a little bit of joint pain, que es un poquito de dolor en la coyuntura. What you really need to look out for, this will occur usually within 24 to 48 hours after you receive the medication. Usualmente los efectos secundarios se ve de 24 a 48 horas después que le dieron la vacuna. And what you're really making sure is that the child does have no severe allergies that will affect their respiratory system. Lo que tiene que estar pendiente es que si le dan algún efecto secundario que le vaya a afectar la vía aérea al niño y no pueda respirar, es una llamada a 911. If you feel like the child is having some difficulty breathing, which is a very rare occurrence, then it's a 911 phone call. But the side effects are really mild. Sometimes the kids don't even realize they have it. A veces los efectos secundarios son tan mínimos que los niños ni se dan cuenta.
And actually, that leads me to my next question. Is it safe to get vaccinated if a child has an underlying health condition?
Yes.
Yes, like autism or any kind of cognitive or mental condition?
Yes. So the other underlying health conditions, depending on what it is, otro condiciones médicas, dependiendo cuál es, this vaccine is actually pretty good because, for example, if you have other medical issues like heart problems, diabetes, that your immune system is sort of compromised, this actually helps you build up your immunity. So para los niños que tienen algunas condiciones médicas como diabetes, problemas en el corazón, o tienen el sistema disponible a infecciones, esta vacuna le ayuda entonces a empezar a coger anticuerpos para proteger al niño contra el virus y otro tipo de enfermedades que le pueden venir. So, even though you have the underlying medical condition, the vaccine will help either prevent you from acquiring the variants, because we've heard of the Delta and the Mu, not so much all COVID, and it will actually help them begin to form that immunity.
Thank you for that. And actually, you mentioned something about the heart. And this is my last question for you, and one that I've been hearing about recently, and I'm sure some of our parents on the call have. So COVID-19 vaccine, and forgive me if I'm saying this incorrectly, myocarditis or heart inflammation. Can you talk a little bit about that popping up during the trials and what that means for kiddos who are vaccinated versus unvaccinated?
Sure. So when the CDC began their what we call clinical trials, where they made the vaccine and they started testing it initially in adults of July 2020. So cuando el Centro de Salud Pública hizo los ensayos de la vacuna, empezó en junio del 2020 en adultos. So what happens is they found everything was fine, but in the age group of 16 to 29, is where they had the rare but risk of a myocarditis. The children that they were about 2,268 in that clinical trial for that age group, there were no child between the ages 5 to 11 that had the myocarditis. So en el ensayo de la vacuna, cuando estaban dándole a los niños, habían 2,268 niños que participaron en el ensayo de la vacuna, y durante ese tiempo de los niños de 5 a 11 años no hubo ningún efecto secundario de la miocarditis, que es la inflamación del corazón. Eso le sucedió en el caso bien raro a los varones de la edad de 16 a 29 años. It really affected males between the age of 16 to 29, and again, very rare. But this study did nothing, and it showed no myocarditis for children between 5 to 11 years of age.
That's really good to hear. And again, as a mother of 4-year-olds and 5-year-olds, that's very reassuring coming from.
I feel the same way. My son is 11, so he's a boy. He's 11. And kind of like what Reuben said, I went and I got it because I'm a nurse here at Optimist as well. And I thought about it for my son, and he actually made the mature decision. He goes, all right, Mama, whenever you're ready, I'll do it. So now I just have to coordinate with him to get it done. I sort of gave him a little bit of a free will to sort of decide, and he was okay with it. So mi hijo tiene 11 años, un varón, igual como mencionó el señor Reuben Felipe, que yo lo cogí cuando me tocó la oportunidad, que soy enfermera también, pero me dio miedo para mi hijo. Pero él y yo hablamos, y yo le di a él la decisión si se quería poner la vacuna, sí o no, porque él tiene 11 años. Y él me dijo a mi mamá, cuando tú estás ready, ven y pónmela. So ahora yo tengo que hacer cita para que él se ponga la vacuna. Y él mismo le está hablando a los amigos en la escuela. My son is actually talking to his friends in school. He's like, look, my mom's a nurse. She's got all these degrees, and she said we have to have it and it's safe. And he is my best spokesperson because he's meeting and he's talking to his friends.
I love that. And we on this call especially appreciate the power of our children's voices and for them to advocate for themselves. Thank you so much, Dr. Rodriguez, for sharing your expertise and for putting some of our fears at bay. Appreciate you. Claudia?
Gracias, doctora Rodríguez, por sus respuestas. Thank you.
Now I will turn it over to Reuben, who has a few questions for our friends at the Bridgeport Department of Health. Claudia?
Ahora Reuben tiene un par de preguntas para nuestros amigos del Departamento de Salud de Bridgeport. Reuben?
Yes, thank you. For our friends at the Department of Health in Bridgeport, can you talk to us a little bit about how you see this vaccine for adults, but also now for children, the kind of impact that it's having in our community?
¿Qué tipo de impacto esperan en la comunidad por medio de la vacuna de COVID?
Sure, if we'll have Deidre answer that.
So obviously our goal with being able to get as many people vaccinated in our community as possible is to see reduced amount of infection. The vaccine, some people may have heard about individuals that have had some breakthrough infections. We do COVID testing here at the health department twice per week, and we have seen that, but individuals seem to be less ill with the infection. That's another advantage that vaccine protection does give. So that is our goal. We're trying to have less people in the community that are ill and less infection in general.
Básicamente la meta del departamento es reducir el número de personas infectadas. Ellos ofrecen pruebas de COVID 2 veces por semana y nuevamente la meta es reducir el número de personas infectadas. Back to you.
And thank you for that, Deidre, because we hear that a lot, right? That the fact that folks who get vaccinated are potentially get COVID as a reason to not get vaccinated, but the fact that usually or overwhelmingly the impact of the disease is less is an important point that I think we need to get to everyone. So thank you for that. So my second question is, what are the more common concerns that you're hearing from folks in the community, particularly when it relates to younger folks getting vaccinated?
¿Cuáles son las mayores preocupaciones en la comunidad y qué ha hecho su organización con respecto a ello, especialmente cuando se trata de los jóvenes?
Hi, so I think I can answer that. This is Ebony. I think, to be honest, because it's fairly new, that the age group 5 to 11 have been approved, I don't want to say that we have an overwhelming concern here at the health department for that as of yet. For the most part, we are focusing on education. So giving, parents the tools that they need to make informed decisions, that's something we're focusing on. But we really haven't heard, as many concerns from parents or just yet in the community. This is one of our first sessions that we're having, educational sessions for parents. So that's definitely a stepping stone. We did have a survey put out for the public school system to gauge the interests of parents and where they sit with vaccination for that subset, that age group. But right now we are focusing on education, just to ease some of the concerns that we know that parents do have. And as a parent myself, I have 2 twin boys that are 4 and are in public school. I do think that when it comes time for them to be vaccinated, that's something that, I am interested in, because I want to make sure that they're protected when I'm not around. I want to make sure that they're protected in a school setting around other children. That's just, a decision and a stance that I am taking. But to be honest, on a broader community concern, I mean, we get multiple concerns, right? We've been in this pandemic now for over a year. So, the health department, is a regulatory agency. So we are still dealing with some of the, environmental impacts of COVID-19 and social impacts, disease impacts. So we just, continue to make sure that our organization is out there and providing the services to the community as needed. I do want to possibly turn it over to Ms. Tammy Papa to explain a little bit more about our vaccination efforts, because that kind of segues into basically what I was talking about.
Great, Ebony, thank you. Let's give Claudia a chance to summarize.
Oh, sure, I'm sorry.
No worries.
Right. Básicamente, la doctora explicaba que honestamente, como esto es nuevo de la vacuna, esta vacuna para los niños de 5 a 11 años, en realidad en este momento ellos no están preocupados y no han escuchado muchas preocupaciones en la comunidad porque es nuevo. Están enfocados en educar a la comunidad, en ofrecer herramientas educativas. Decididamente a lo que quieren hacer es ver por medio de una encuesta en las escuelas tradicionales qué tipo de preocupaciones hay, pero en este momento nuevamente el enfoque es la educación. Ella tiene gemelos y personalmente ella siente que los quiere proteger, especialmente cuando regresen a la escuela. Y nuevamente el Departamento de Salud, el mayor enfoque es el impacto social que se tiene por el COVID. Obviamente hemos estado en esta pandemia por más de un año y lo que queremos es proveer servicios y me gustaría que Tammy Papa hablara un poquito más acerca de los servicios que tenemos y que podemos ofrecerle a la comunidad.
Emily, thank you for that. And you actually segued perfectly into my last question. And so Tammy, if you can tell us a little bit about both the vaccination and testing services that are available. And I also want to ask that question to Dr. Rodriguez on behalf of Optimus as well.
Y so I'll just translate quickly. Vamos a pasar ahora con Tammy Papa, que va a hablar más acerca de los servicios que está ofreciendo el Departamento de Salud de Bridgeport con respecto a las pruebas y a la vacunación de COVID. Thank you, Ms. Papa.
Thank you, Claudia. Good evening, everyone. And yes, so the Bridgeport Health Department has a number of opportunities for individuals to get both tested and vaccinated. Currently, as Dee mentioned, we do testing twice a week while our focus is on city employees and getting those that are not vaccinated tested. We also serve a lot of individuals from the public who know about the testing site. So everyone is welcome. That happens currently Monday and Thursday evenings from 1 to 6. Claudia, you want me to stop there?
Sure. Hay un número de oportunidades que estamos ofreciendo para que se hagan la prueba de COVID y para vacunarse. 2 veces a la semana se ofrecen, el lunes y el jueves por la tarde de la 1 a las 6. Estamos enfocados en los empleados de la ciudad, pero también hay otras personas en la comunidad fuera de los empleados que también están tomando parte de la vacuna y también de hacerse las pruebas. Thank you.
So that's for testing only, and that's Monday and Thursday from 1 to 6 at the Bridgeport Health Department, 752 East Main Street. And then I'll get into vaccination efforts as well.
Una corrección, lo que dije antes se está ofreciendo solamente para las pruebas de COVID de lunes y jueves de la 1 a las 6 y esto lo ofrecen en el Departamento de Salud. Do you mind repeating the address for the Health Department, please?
Sure, 752 East Main Street.
Y está localizado el Departamento de Salud en el 752 de East Main Street aquí en Bridgeport.
Thank you, Claudia. Thank you. So in addition to that, there are obviously a ton of testing sites throughout the city, and everything can be found, all of the testing information can be found on our getvaxbpt.com website. So if all else fails, if you visit that website, you'll have all the up-to-date information, educational materials, and testing and vaccination clinics. And I'll pause so you can translate that.
También quiero informarles, a Ms. Papa, que también hay diversos lugares donde ustedes pueden hacerse la prueba de sitios. Y una manera muy fácil de obtener esta información es yendo al sitio web de GetVaxBPT. Ahí vamos a compartir esta información después también para que la tengan. Ahí también encontrarán materiales educativos. Thank you.
Another large testing site as well is our North End Library that's actually operated through the State Department of Public Health. And that is open 7 days a week, various hours. And again, everything can be found on our website.
Y nuevamente otro lugar donde pueden también ir para las pruebas es en la biblioteca que está, que le llaman de North End aquí en Bridgeport. También ahí es otro lugar donde pueden ir para hacerse la prueba de COVID.
Thank you. So for vaccination, our focus right now with the Bridgeport Health Department has been on children ages 12 to 17 and adults ages 18 and up. We are in the process of doing some vaccination training refreshers for some of our vaccinators for younger children. So while we are surveying in the Bridgeport Public Schools, looking at these refresher trainings and the opportunity based on the feedback we get back from our parents in the public schools, we will look to do vaccination clinics for 5 to 11-year-olds as well.
Nuevamente, en este momento el enfoque ha sido para las vacunas para jóvenes de 12 a 17 años y para adultos de 18 para arriba. Vamos a tratar también de hacer entrenamientos donde para que la información se imparta nuevamente, y estos entrenamientos van a ser para la vacuna para los niños más chicos, la nueva vacuna. I think, yeah, that's it.
And if and when we do those clinics, they will obviously be open to all families with children in that age group, not just public schools.
Y nuevamente, cuando se hagan estas clínicas, se van a abrir para todos los padres de familia que tengan niños de 5 a 11 años. No va a ser solamente para los niños que vayan a las escuelas tradicionales en la ciudad, sino para todas las personas en la comunidad que tengan niños en ese grupo de 5 a 11 años. Thank you.
Great. So in addition to that, I just want to briefly touch on it for those parents that are on the call that maybe have not thought about or are thinking about getting vaccinated themselves and may not be vaccinated yet, and now concerned also about their children. We obviously still hold a number of clinics. Our Friday clinic at the health department is open to anyone. We are also providing boosters for anyone that is 6 months out of receiving their vaccine, Moderna, Pfizer, as their primary series, and 2 months if they receive the Johnson & Johnson. So pretty much everyone is able to get that booster. And it is highly recommended for those 50 and over, and then anybody age 18 to 49 may also receive it. And obviously no word yet on the younger kids, 12 to 17, because they are they are more than likely not they haven't reached their 6-month mark yet.
Okay. Y solamente también quería dejarles saber que las clínicas que tienen los viernes están impartiendo, no sé cómo se dice en español, pero el booster para la vacuna de Moderna y de Johnson & Johnson. Y esa es obviamente la que se da después de la vacuna inicial, 6 meses después cuando le pueden dar la de booster. So también se está ofreciendo eso en las clínicas los viernes.
So just a correction in case I didn't hear you correctly, it's 6 months out for Moderna and Pfizer, 2 months for Johnson & Johnson.
So 6 months out from Moderna and Johnson & Johnson? And,
no, Moderna and Pfizer, and 2 months out for Johnson & Johnson. That's when people can receive their boosters.
Perdón, una corrección. So Moderna y Pfizer son 6 meses y para Johnson & Johnson son 2 meses después.
Thank you, Claudia. I understand better than I can speak, so thank you for being here for that.
You're doing better than most, Tammy.
Okay. And in addition to that, we also have all of our partners in the community. Obviously, Dr. Rodriguez is on the call for Optimus, and she'll talk to you a little bit about their upcoming clinic for 5 to 11-year-olds, but we also have Southwest. We are doing a number of clinics through an equity grant with the state, and our state DPH, I know, is on the call. They are also partnering. So we are out in the community. We are asking that everyone spread the word about getting vaccinated. There are so many opportunities in which people can get vaccinated. You really want to check that Get Vax BPT website. We update it daily.
Y nuevamente, pidiéndoles a todos que tomen parte de lo que se está ofreciendo en la comunidad. Southwest también está participando con ellos, y nuevamente les indica a todos que por favor visiten a Get Vax BPT, porque ahí está toda la información que ustedes necesiten acerca de los servicios que se están ofreciendo en la comunidad. Thank you.
Thank you, Claudia.
Thank you. And I just want to give Dr. Rodriguez an opportunity to share.
Sure. Thank you. So Optimus also, we are at 982 East Main, and we offer vaccines daily, Monday through Friday, 8:15 to 4:45, with the late night on Tuesdays till 6:30 to accommodate the parents that are working. So nosotros aquí en Optimus, que estamos localizados en el 982 de East Main Street, tenemos clínicas al diario de lunes a viernes, de las 8:15 de la mañana hasta las 4:45, y los martes estamos tarde hasta las 6:30, disponible para los parientes que trabajan y necesitan traer los niños después. Just like Tammy, you know, we collaborate a lot. We're not doing testing anymore. We're focusing a lot more on vaccines. We have a walk-up clinic. You don't need an appointment for your main shot and your booster. Nosotros tenemos la clínica sin cita para los adultos que necesitan su tercera vacuna o su primera si no la ha recibido. We do encourage just for the children to call. We have you call 203-696-3260 to schedule an appointment, only so that we can control it a little bit better. So las otras vacunas no necesitan cita. Nosotros solamente quisiéramos que llame al 203-696-3260 para hacer una cita para su niño, para así nosotros tener todo lo necesario y tener los niños en un día para poder hacer la vacuna adecuada a la edad de 5 a 11. Pero los demás no necesita vacuna, no necesita cita de 12 en adelante por los adultos. Okay.
Awesome.
Thank you so much, Dr. Rodriguez. And we have up next, Lane Taylor, who's the medical director for the Village for Families and Children here in Hartford. Ms. Taylor, as our parents continue to think through whether vaccination is right for their loved ones, can you speak to some of the consequences and or side effects on our young people as it relates to COVID, and how getting our kids vaccinated specifically can be an effective antidote to some of those issues?
Yeah, absolutely. Sorry.
I'll just translate quickly. Nuestros padres continúan pensando sobre la vacuna, sobre si esa vacuna es correcta para sus seres queridos. ¿Puede hablarnos sobre las consecuencias e impactos, particularmente sobre el incremento en depresión y ansiedad en la juventud en el pasado año y medio con respecto a COVID? Por ejemplo, el miedo de regresar a la escuela, o de reaprender cómo interactuar con sus semejantes, o la pérdida de aprendizaje y su impacto. Thank you.
Thank you.
Thank you so much. So it's such a pleasure to be here, and I really appreciate this opportunity to fold into a discussion about mental health along with COVID, because to be honest, this has affected everyone on so many levels beyond our physical health. And, you know, it's long been established that our physical health and our mental health are very connected and interconnected. I'll pause, Claudia.
Un placer estar aquí con ustedes. Quiero hablarles específicamente sobre la salud mental, porque esto nos ha afectado a todos y se ha establecido que la salud mental directamente contribuye con la salud física.
And, you know, we've had our kids have to be out of school and away from their friends and not being able to see their loved ones for 2 years now, right? And that has very directly impacted how they feel comfortable socializing, about their sense of security. And what we've seen is a great deal of an increase in anxiety and depressive symptoms for many kids.
Los niños estando fuera de la escuela, no pudiendo ver a sus seres queridos, hemos visto un incremento en la ansiedad y cómo les ha afectado bastante el no poder tener esa conexión con sus seres queridos y desenvolverse en la escuela como lo hacían normalmente.
On an extreme level, many of our kids have seen loved ones die and have seen their community and their family members struggle on so many levels, financially, physically, and maybe even their parents who previously were of good health now struggling greatly from something even like long COVID. So it's hitting directly in their homes, and they're witness to all of this, usually the healthiest member of their family.
Estamos viendo en extremos donde a veces nuestros niños han visto a seres queridos morir. Hemos visto, ellos han visto el impacto financiero y también han visto cómo COVID puede afectar a largo término. Entonces, esto es algo que los está afectando directamente a ellos también.
In addition, as they've been away from their friends, away from their school, the ability to really socialize and do what's developmentally normal for kids, which is build friendships, that's been stunted in this process of us trying to keep our community healthy. And so there's been a fallout with kids being able to have and develop normal relationships.
Nuevamente, que los niños hayan estado lejos de sus amigos, les ha impactado bastante en la manera que ellos pueden tener, desarrollar amistad con sus amigos, desarrollar relaciones de amistad. Entonces, nuevamente esto ha impactado y parado de cierta manera la habilidad de nuestros jóvenes de poder desarrollarse en esas áreas.
And the schools have often been the source of support for children who might be struggling in non-COVID life, right? Whereas there might be social workers or teachers or administrators who would be their touch points when they're struggling.
Nuevamente, muchos de estos niños, en muchos casos, que tenían retos, antes de COVID, ellos tenían, por ejemplo, a una trabajadora social, alguien dentro de las escuelas que los ayudaba. Entonces, en este momento no han tenido acceso a estos profesionales.
And the kids have not only struggled academically, usually because of the distance learning being such a learning curve for schools and for kids and families, but also they have had a lack of access to people who might otherwise be able to identify those early signs when kids are struggling.
Nuevamente, otro reto que hemos tenido es que los niños sí generalmente tenían retos académicos, tratando de cerrar esa brecha educativa. Ahora ellos no tienen acceso a estar con profesionales que pueden en algún momento identificar algún problema que tengan estos jóvenes.
And so what we've had is kids falling behind. We've talked about the education gap, especially for our Black and brown children, but we also have an even greater education gap and an even greater mental health gap or access to mental health gap since kids have had to be remote from school.
Y nuevamente, hablando de esa red educativa, los jóvenes, nuestros jóvenes, nuestros niños están muy atrasados, especialmente nuestros jóvenes latinos y afroamericanos. Nuevamente está esa brecha de salud mental y todo eso está afectando demasiado a los jóvenes.
And so as they're going back to school, trying to get back to normal life, now there's a lot of apprehension and anxiety and worry about what that's going to be like to be back with your friends, be back in school full time.
Y nuevamente, ahora los jóvenes están experimentando, regresando a la escuela, una presión, se sienten quizá un poco desconcertados de cómo va a ser el regresar a la escuela y renovar la asociación con sus semejantes.
So in the clinics and those of us who serve kids in mental health, we're seeing a significant increase in anxiety and depression. We're seeing kids doing a lot of avoidance that could look like avoiding school, avoiding social interactions. That could, at its worst, look like thoughts of suicide, wanting to avoid life entirely.
Nuevamente en nuestras clínicas estamos viendo un incremento en problemas de salud mental, mucha ansiedad, mucha depresión, los niños tratando de no regresar a clases, en algunos casos también contemplar suicidio.
Practically speaking, for the majority of kids, you might see kids that are really kind of struggling with sleep. You might start to see the kids with changes in their eating behaviors, irritability, social isolation, and even a change in their academic performance. This is actually much more common than what you would think.
Nuevamente también se está viendo que estos niños en muchos casos tienen problemas para dormir, están teniendo problemas en sus dietas, de lo que están comiendo, cosas que están afectando su dieta, están bastante irritados y decididamente está afectando la educación académica.
So while the vaccine's not going to change those things, right? The health and well-being of our community will. Being able to get back to in person, being able to connect with those who are great supports in our community, helping families and parents know what signs to look for in order to make sure they get help for their children. All of these things we can do better, more efficiently when we're all back in work, we're all back in the schools, we're all back with our supports that were typically there.
Nuevamente, la vacuna no va a cambiar todo esto, pero lo que sí queremos, estamos seguros que si regresamos a lo normal, donde todos estos jóvenes van a tener acceso a todos los aspectos de los que hablamos, a las trabajadoras sociales, a cualquiera de estos servicios que hay para los jóvenes. Sabemos que esto solamente va a suceder si regresamos a actividades normales y la forma de hacerlo es si estamos vacunados.
And then finally, with regards to how the vaccines can make a difference, is that when kids aren't having to deal with being out of school for 14 days at a clip because, their classmate was, was ill, or their family member, where they were exposed to their family member, if they're able to be healthy and vaccinated, that reduces the amount of time that they otherwise might miss from school and other activities.
Y nuevamente un punto muy importante es que si estamos vacunados se puede reducir. Entonces, por ejemplo, un niño que tiene que estar fuera de la escuela 14 días porque un miembro de su familia fue infectado de COVID o otro de sus semejantes en la escuela fue infectado, nuevamente vamos a reducir ese número de días que los niños no pueden estar en la escuela si estamos vacunados.
Dr. Taylor, thank you so much for really digging into what I know we previously discussed as a very sensitive issue when it comes to discussing the mental health of our kids. I really appreciate you really digging in and having the hard discussion with all of us this evening. Dr. Taylor, if you could just tell us briefly, what are some of the supports or resources that the village is providing that have been the most impactful or well received over the last year and a half, 2 years?
¿Qué tipo de recursos y respaldos ofrece la villa que han sido bien recibidos y de impacto en la comunidad?
Thank you, Claudia. I'm so sorry. So, here at the village, we have a number of services, and actually, my friends over at Optimist in Southwest, also down in Bridgeport, have a great number of resources. But at the village here in Hartford and the other section of the state, we offer nearly every level of care to families and children.
Nuevamente, gracias a Optimus y a las otras organizaciones que están ofreciendo estos servicios, nosotros aquí en Hartford tenemos básicamente todos los niveles de servicios para la comunidad.
We have outpatient, we have access to in-home services, we have actually residential, and then non-clinical services include financial support, helping families understand how to be successful financially.
Tienen servicios para pacientes y también ofrecen un programa de respaldo económico. No es clínico, pero es una manera que ofrecen para educar a las personas en la comunidad sobre materias de finanza.
And then we've actually increased our presence in schools, in the Hartford public schools. We have social workers and psychologists, and those children also have access to the clinical services here at the village.
y han incrementado su presencia en las escuelas tradicionales. Tienen trabajadores sociales y psicólogos los estudiantes también tienen acceso a los servicios que ellos ofrecen en general.
And then finally, we've been a part of, just like the Department of Health for Bridgeport, we've been able to partner up here to do a vaccine outreach with the Department of Health to be able to reach areas of Hartford, specifically the south end of Hartford, which is now expanding to broader Hartford, in order to increase education on the vaccines as well as access.
Nuevamente, en este momento están trabajando con el Departamento de Salud en Hartford, especialmente para ayudar a las personas que viven en el sureste, en Hartford, y lo que quieren hacer es básicamente seguir educando a los ciudadanos sobre la vacuna y los servicios que ofrecen.
Great, thank you. Thank you again, Dr. Taylor, for all the wonderful information you provide this evening, for lending in on your expertise, and for letting us know all the great things that the village is doing here in the greater Hartford area. Thank you again, Dr. Taylor. And before we move on, Ms. Ebony Shahid just wanted to make a quick point before she had to hop off the call. So I'm going to hand it over to her for a minute.
Thank you so much, Nakia, for just letting me make this point. I just wanted to say one thing. I know that for parents, a lot of times they're very interested in the side effects of the actual vaccine. And then I think sometimes what we forget, and I know sometimes I don't think about, the actual disease itself, but I just think it's important to remember that although children are at lower risk of becoming severely ill with COVID-19, as compared to adults, they still can be infected with the virus that causes COVID-19. And I think that, we also, need to remember that children can get sick from COVID-19. They have both some short and long-term health complications from this disease, and they can spread COVID-19 to others. So I think that sometimes we talk about, some of the side effects of, the vaccine, but we also need to look at the long-term, short-term complications and of the actual disease itself and the impact that contracting that disease will have or can have on our children. And so, so that's just something that I wanted to, make sure that we also think about when we're trying to make that informed decision on how to best protect, our kids.
Nuevamente la doctora Ebony quería recalcar para los padres de familia que están interesados y nuevamente hablan de los efectos secundarios de esta vacuna. Quería recordarles lo que es el tener COVID. Sabemos que el riesgo es mucho más bajo para los niños que para los adultos, pero quería recordarles que los niños también se pueden enfermar y también pueden darle esta infección a otros. Quería recordarles que tenemos que tomar en cuenta las consecuencias a término corto y a término largo de tener, de que te pegue el COVID, el impacto que eso va a tener con nuestros hijos. Entiendan eso en lo que ustedes están tomando decisiones acerca de vacunar a sus hijos. Recuérdenlo, por favor. Thank you.
Great, thank you so much, Claudia, and thank you again, Ebony, for reminding us of the real health implications for our kiddos as it relates to COVID. Thank you again for that. Right, so before we start our Q&A this evening, I want to introduce Ari Nieves and Olivia Hines, who will briefly talk about the work they are doing in the community. Ms. Nieves is the Bridgeport City Council President, who works with Olivia Hines, a DPH vaccine program coordinator, to support the facilitation of the COVID vaccine equity program, which I'm very excited to hear about. So welcome to the both of you. Can you give our audience a brief overview of the work you're partnered on to make vaccinations accessible in our communities? Claudia?
Antes de iniciar la porción de preguntas esta tarde, me gustaría introducir a la señorita Ari Nieves y a Olivia Hine, quienes hablarán brevemente sobre su trabajo en la comunidad con respecto a las vacunas. La señora Nieves es la presidenta del Ayuntamiento Municipal de Bridgeport y está trabajando con la directora del Departamento de Salud del Condado de Bridgeport y están trabajando en todo el condado de Fairfield para dar respaldo y facilitar el programa de equidad en la vacunación de COVID. Su enfoque es ofrecer clínicas en comunidades socialmente vulnerables. La señorita Hines es asociada estatal con el departamento encargada de trabajar con distritos locales escolares con el programa de vacunación. Bienvenidas las dos. Les pueden dar a nuestra audiencia una breve presentación de su trabajo por el cual dan acceso a la vacunación para las comunidades. Adelante.
Good evening, everyone. I am Heidi Nieves, and I am the Regional Coordinator for Vaccine Outreach for Region 1 in the Fairfield County area. My role with the Department of Public Health is to outreach to organizations, entities, groups that are willing to host a vaccine mobile clinic in partnership with our equity grant. I am right now currently partnering with the Bridgeport Health Department to ensure that we're bringing the vaccine to where the community is. And we're also partnering with other members in the community. We have, South FQATs, which are like Southwest and Optimus, which are based in the schools and in communities. They're also hosting clinics, but also sometimes the churches want to host their own vaccine clinic and helping them support them through that role. That's the role that I have right now with vaccine equity. It's really working with the health department, health directors throughout from Bridgeport all the way down to the Greenwich line to ensure that we have enough vaccine clinics happening in the communities. I think some people have seen them at St. Charles Church, outside of McDonald's. Gala Food had some over the summer outdoor clinics. Now we're moving into the indoor store again because the pediatric vaccine has been rolled out. That's the other level of support that we're trying to ensure that we're bringing them to where residents feel comfortable and it's their safe space. Sometimes it's not in school or at the clinic and they're willing to do it if their church is having an event. So that's my role currently right now. And I'll let Olivia explain what her role is in regards to working with the schools. Thank you.
Just very quickly, en un resumen, básicamente Ms. Nieves acaba de impartirles que ella, como en su trabajo de directora regional, están en este momento ofreciendo la facilidad desde Bridgeport hasta la línea en Greenwich de poder tener estas vacunas disponibles tanto en organizaciones, en escuelas o en sus iglesias. Muchas veces los padres de familia o miembros de la comunidad se sienten muy a gusto de pronto que tomar esta vacuna dentro de sus iglesias. Entonces puede ser en McDonald's, en Gala Food, hay diversas oportunidades y se pueden comunicar con ella, especialmente ahora que ya está disponible la vacuna pediátrica para estos niños de 5 a 11 años. Thank you.
Hi, everyone. Oh, sorry. Hi, everyone. I'm Olivia Hine, and I am a vaccine demand strategist for the CDC Foundation, and I am currently working as a part of the health equity team at the Connecticut Department of Public Health, and I focus on the school initiative and the Vax to School vaccine program, which for those of you who don't know, is a program run by the DPH with the assistance of Griffin Health that provides schools with a clinic at their school if they would like one. So if a school requests assistance with the DPH, then we will send a yellow van, which I'm sure some of you have seen in the community. And this van comes with a trained Griffin staff to administer the vaccine. And since November 6th, which was the first day we started doing the 5 to 11 clinics, we vaccinated almost 7,000 children, which is not including non-school clinics. So I'll keep it short, but yeah.
This is wonderful. I'll translate quickly, but I'm going to ask you again about that number.
Oh, sorry.
Quite all right. So, básicamente Olivia Hines es parte del equipo de equidad en vacunas y ella básicamente está enfocada en la iniciativa con las escuelas, organizando todo eso. Cuando una escuela quiere proporcionar una clínica dentro de la escuela, mandan a una van amarilla del departamento de Griffin Health y esta viene con personas especializadas que pueden administrar la vacuna. Y también indicó desde que se empezaron comenzaron a hacer estas vacunas, en este momento tienen a 7,000. You said 7,000 children vaccinated up until this point. 7,000 niños que ya han sido vacunados desde que se inició la vacuna de 5 a 11 años. Thank you, Olivia.
Thank you.
That is an amazing number. Thank you so much for the work,
Yes.
Olivia and Heidi, that you're doing in the community. And thank you again to all of our panelists for leaning in with your expertise this evening. It means a lot to me as a mother, and I'm sure to all of our families on this call tonight who are just trying to get really good information they can use to make the best decisions for their families. Thank you again. So Claudia, you want to translate?
Gracias a todos los panelistas por compartir su conocimiento. Muchísimas gracias por toda la información que han impartido. Y ahora vamos a hacer a unas preguntas a nuestra amiga Laura Callaghan del Connecticut Charter School Association. Ella ha estado monitoreando el chat esta tarde. Laura nos va a proporcionar las preguntas que se han estado haciendo por medio del chat.
Thank you, Claudia. Yes, so let's jump into our Q&A. Our friend Laura Callaghan from the Connecticut Charter School Association has been keeping a watchful eye on all of your questions coming through this evening. So Laura, I would love for you to hop on and tell us what are some of the questions that you are seeing from our families.
Hi, yes, hi everybody. There's been a bunch of really good questions coming in. I don't know if we'll have time to get through all of them, so I'll just repeat what Nakia said at the beginning, that there will be stuff sent out after, and if we don't get to your question, don't worry, because we will. Claudia, I don't know if you wanted to.
Nuevamente, Laura va a hablar sobre los temas comunes que han estado en el chat, y no se preocupen si no contestamos su pregunta ahora. Nuevamente le reiteramos que vamos a contestar todas las preguntas después y se las compartiremos.
Thank you. So these questions do not come in with a sort of directed to any particular panelist. So I invite anyone who feels they would like to try and answer these to please do so. Our first question was around, should you get your child the vaccination if they have chronic asthma or other respiratory issues? Claudia, could you translate that question? Thank you.
Nuevamente, una de las preguntas que se hizo es, ¿debería de darle esta vacuna si su niño tiene asma crónica o otros problemas respiratorios?
I'll take that. Yes, they should, because it's a virus. It's flu season that's also coming, so it begins to mimic some symptoms of the flu, and you want to make sure that you give your child the best start by getting them the vaccine. So sí, nosotros recomendamos que niños que tengan asma le pongan la vacuna, porque este es el tiempo de la gripe y muchos de los síntomas son iguales y pueden afectar la vía aérea. So es muy importante que le pongan la vacuna para ayudarle a reducir los riesgos que tenga esta época para contratar la gripe o el virus variante que está con COVID.
Thank you, Dr. Rodriguez. Another question that I saw in the chat was around, at the beginning of the pandemic, there was a lot of information that it would take years for the vaccine to come out, and parents are still concerned just to know that how can we know this vaccine wasn't rushed? How long were the trials? And if there's any insight into why were we able to get it so much quicker than initially anticipated?
I had spoken a little bit about that before. So the technology to develop this vaccine has been in existence over 15 years. So yo mencioné anteriormente la tecnología para hacer esta vacuna está más de 15 años en existencia. So eso no fue una cosa de la noche al día siguiente. This wasn't something that was overnight. The trials began with the adult dosage vaccine June to July of 2020, so it's already been 1 year. La vacuna, en cuestión de estudiar qué es lo que estaba sucediendo, empezó en junio a julio del año pasado, 2020. Ya estamos en 1 año. So what happened is the vaccine has already been tested in adults. With children, everything is based on their age and their weight, and that's why the dosage is 1/3 of what the adults receive. Cada vacuna que se hace para los niños siempre empieza con los adultos en cuestión de la investigación. Después que se determine que la vacuna está bien, en este caso, cada medicina que se le produce a un niño siempre es por su edad o su peso. Por eso es que el niño va a recibir un tercero dosis de la medicina y no es completamente la dosis del adulto. So again, it's because the studies have been over a year. On the adults, it was close to 20,000, if not more. The children started at 4,000 above from different ages. It started from 6 months old all the way up to 18. And so you cut that segment out, and the 5 to 11-year-olds had the 2,200. Al principio había más de 4,000 niños, empezando de la edad de 6 meses hasta 16, 18 años. Pero para esta edad de 5 a 11 años, hubo 2,268 niños que se le hizo el estudio y no hubo ninguna complicaciones. And so that's, you know, it wasn't rushed. It's happened that we have the technology from the past. We just had to isolate that virus to begin the vaccine production.
Thank you so much. And that's actually a really great segue to one of the other questions that we saw around if your child is 11 but turning 12 soon or will be 12 before they would need their second dose, which vaccine should they receive? Should that family hold off until they're 12?
No, I think they should just do it now. If they start at the 11, they'll get the 11-year-old dose at the second time, unless the pediatrician decides to do the adult dose. I wouldn't wait. I just did it now, and then by the time the second dose comes in, they can consult with the physician. Si tu niño tiene 11 años y va a cumplir 12, y gente está empezando, si quieren esperar, hágalo lo más antes posible. Van a recibir la dosis de cualquier manera. En el momento va a recibir un tercero y su segunda vacuna quizá va a ser lo mismo. Si tiene cualquier pregunta, llama a su pediatra y ellos le pueden contestar cualquier otra pregunta que tenga.
Thank you. Another question we saw come through, and I know there was a lot of talk around this, around sort of some of the benefits and pros of children getting the vaccine, even though it doesn't necessarily 100% prevent them from receiving COVID. But if those sort of what are those benefits can be elaborated on? There were some concerns about, you know, if my child is still going to get sick, sort of what is some of the other offsets of the vaccine?
Anybody?
Perhaps Tammy might be able to lean in here.
No, I'm thinking I'm probably not the best person to answer that.
Can you repeat the question again?
Sure. So the question is, aside from reduced risk of contracting the COVID-19 disease, what are the other benefits of receiving the vaccine, since it doesn't always necessarily prevent contracting the illness?
So, you know, studies have talked about once you receive the vaccine, you begin to build your immunity, but we've heard that people still get that breakthrough COVID because part of it is from the variant, ¿verdad? So, estamos escuchando que uno recibe la vacuna y de cualquier modo todavía en otra etapa salen positivos con la COVID-19. But basically what happens, I equate it to like on a scale of 1 to 10. If you've never received the vaccine, it's going to hit you like a Mack truck on a scale of 10. The worst, you're probably in the hospital, it hurts. Si uno nunca recibió la vacuna en una etapa de 1 a 10, es lo peor, un dolor bien significante, right? But if once you get the vaccine and you build it and you build your immunity, the chances of you feeling that bad have reduced considerably. It might be just like a 2 or 3. You might just feel like the flu, but not as bad as if you were not vaccinated. Si uno recibe la vacuna y sale y contagia la COVID-19, pues muchos de los síntomas que uno va a recibir, no lo vas a sentir tan fuerte. Va a ser un poquito menos. Y usualmente no requiere estar en el hospital, pero siempre es mejor recibir la vacuna y prevenir que no tenerlo y caer en el hospital con unos síntomas peores de la cuenta.
I was wondering if I could also add, just to piggyback on that, that the population who are vaccinated are still at a much lower risk of actually contracting COVID than those who are unvaccinated. I'll pause for Claudia and then.
Ella quería reiterar que los miembros en nuestras comunidades que han recibido la vacuna están al riesgo muy bajo de contraer COVID que los que aún no han recibido la vacuna de COVID.
And for our children, you know, when they're around our elderly, 50 and older, those are the individuals who are actually the ones who are, even if they're vaccinated, you know, are still at higher risk for illness. And so when we protect our kids from COVID, we're protecting our most vulnerable as well.
Y nuevamente, a nuestros niños cuando están alrededor de adultos de 50 años para arriba, ellos están a más alto riesgo. So, quiero reiterar que cuando vacunamos a nuestros niños, estamos protegiendo también a nuestros seres queridos de edad avanzada. Thank you.
Thank you for leaning in, Dr. Taylor, with that additional information as well. Anything else you see, Laura, on your end?
There were a few others coming through. Do we have any additional time, Nikki? Or I know we will be sending out some sort of summaries of the questions and answers after. Would that be better?
Yeah, let's maybe one more and then we can wrap up.
Sure. One of the other ones that I saw was around, oh my gosh, I just lost it. Sorry, I pasted it in here. Oh, around the flu vaccine as well. Should, if your child is going to be getting the flu vaccine and the COVID-19 vaccine, is it better to do those at the same time or separate?
La pregunta es si su niño va a recibir la vacuna para el flu, para la influenza, y también la vacuna para el COVID. ¿Ustedes recomendarían que la tomen al mismo tiempo?
So I know from our standpoint with Bridgeport Health Department, we've been giving both at the same time. No issues with doing that.
Sammy quería indicar que en el Departamento de Salud de Bridgeport han estado dando las dos al mismo tiempo y no han tenido problemas, no han visto ningún problema en este momento haciéndolo de esta manera.
What I will say, just to piggyback off of that, if you have any additional questions about that, it's really important to make sure that your primary care physician or your provider is privy to any type of decisions that you're planning on making. So let them, you know, kind of guide you if you have any additional questions such as those.
Y nuevamente solamente recomendándoles a todos los padres de familia, si tienen alguna pregunta, alguna incertidumbre, por favor hablen con sus doctores, con su doctor primario para que ellos les den guianza acerca de estas preguntas que ustedes tienen o incertidumbres con respecto a esto.
There's been no indication that you have to separate them at all, that they can be given together. You know, when we take our kids in for the early vaccines, they get multiple in one time. Personally, practically as a parent, I'm thinking taking my kid for 2 separate shots. No, thank you.
Y nuevamente reiterando que no ha habido ninguna indicación de que ha habido un problema dando estas vacunas de la influenza y del COVID al mismo tiempo. No ha habido ninguna indicación de problemas. Y nuevamente cuando están pequeños los llevamos a que les den vacunas, les dan múltiples vacunas y yo como madre digo, en vez de llevarlo una vez y después otra vez para otra, pues si se puede dar al mismo tiempo, qué mejor que eso.
I really appreciate that, Dr. Taylor, as again, my 4-year-old and all the shots he has coming up at the end of the year and having to bribe him with lollipops. One shot would be, you know, a one-stop shot would be great, but I definitely respect Ebony leaning in on, you know, definitely if you have questions or concerns, consult your physician, consult your pediatrician, and let them know, you know, what's at the top of your mind when it comes to multiple vaccinations at once. But I appreciate both. Thank you so much. This has been awesome. Like I said, we're not able to get through all of our questions. I want to make sure I get you all out on time. So I know some of you may still have dinner to get on the table, bath time, just R&R time, and I respect all of that. So we'll be sure to, again, get all of the unanswered questions posted on CTCSA's website, as well as your kids' school's website. And we'll be recording this both in English and Spanish, so you'll be able to go back and view it at your leisure and share it with your friends, those who are unable to attend. I will throw it over to Claudia for closing remarks.
Sí, estamos llegando al final del foro y queremos honrar el tiempo que nos han dedicado y sabemos que es súper valioso. Gracias nuevamente a los panelistas que nos acompañaron y a los oficiales electos por acompañarnos esta tarde y por darle luz a una muy necesaria a este tema de las vacunas de COVID-19 y las implicaciones en nuestras comunidades. Gracias a las familias que participaron. Esperemos que este foro les haya dado resultados informativos y que les haya ayudado a la medida que ustedes van a tomar estas decisiones. Nuevamente un recordatorio, habrá una grabación en inglés y en español después del receso de Acción de Gracias. Contestaremos todas las preguntas que no alcanzamos a contestar hoy en el chat y compartiremos estas respuestas en el sitio web del Connecticut Charter School Association y con sus líderes escolares. También estaremos compartiendo enlaces para información de fuentes fiables. Nuevamente, muchísimas gracias, que pasen muy buenas noches y feliz Día de Acción de Gracias.
Thank you, Claudia. You are the MVP for this evening, for sure. We are nearing the end of our forum, and I want to honor the valuable time, as I said, that you shared with us. Thank you, thank you, thank you again to our panelists and our elected officials for joining us this evening and shedding some much needed light on COVID-19 vaccinations and the implications for our communities. Your insights have been invaluable, and I'm hoping families walk away with much more information than what they came in with. And thank you, families, for participating. We hope you have found this informative and that it has helped you in your decision making. As a reminder, again, a recording of both English and Spanish will be available after Thanksgiving break, as well as all the unanswered questions from the chat. They will be posted to CTCSA's website, which you can find a link to in the chat, and also to your children's schools. And I've also added some additional links to resources, trusted resources, if you want to do some additional research on the COVID vaccination and the implications for your children and your family members. To that end, good night and happy Thanksgiving to everyone. Thank you again so much for joining. Be safe and be well, everyone.
Good night, everyone.
Good night.
Good night.
Thank you. Good night, everyone.
Thank you, Dr. Taylor. Thank you, Tammy. Thank you, Olivia. Thank you, Heidi. Thank you, Ebony.
Thank you.
Thank you, Dr. Rodriguez.
Thank you.
Thank you.
Thank you so much. Really appreciate you all. And to my wonderful CTCSC team, thank you.
Thank you, Nakia. Have a great night.
So I'm going to stay on just so folks can get to the links if they need to. Keep those up.